Hey Mo,
Hey, Ricky.
the doctor is in. The doctors are in. I got two docs today. I'm
Yes, yes. Hey, Dr. Sherry.
Oh, doing,
It's
girl.
magical. It's so good to
It's,
see your face in the place. You look amazing. You glowing. You got that glow.
She
thank
is glowing,
you.
and
I'm always so
her
blessed.
colors are so beautiful. That blue is so like she's like in the ocean. It's like
Yeah,
lovely.
it's peaceful. I feel very centered.
Yeah, very zen, very zen. We're so
Well,
happy to have.
that was very purposeful because March being Lymphedema Awareness Month,
Mm-hmm.
Yes,
aqua being the color for
Mm-hmm.
lymphedema awareness, I was very proactive in putting that together. And when Ricky, I'm about to call her Dr. Ricky because we were just joking earlier.
no,
When Ricky reached out to me and said, Dr. Cherie, can you be, on the show again? We want you back for, Lymphedema Awareness Month. I was blown away. I mean, we've been talking about this, since like November. And then it
right.
just like crept up on me. And that just lets you know just how quickly this time is passing.
Oh my gosh,
True.
I can't believe
It's
it's
true.
March already. Like this year has gone. I can't even remember Christmas.
I mean, January took 6 months, but February flew by. So here we
Right.
are. Yeah, but spring is coming either way, and it's time for people to get outside. It's time to start exercising. If you haven't been, it's time to start planting your flowers, getting out in the garden. And all the questions patients ask me about what can they do and what can't they do with lymphedema and what should they be concerned about. Today, we're going to really elucidate. We're going to get to the bottom of these things and shed some light on these things. And so, Dr. Cherie, I'm so excited that you're here and for the work that you're doing in this field.
Yeah, so excited. So
Thank you, thank you, thank you. So listen, we know, the three of us know about, what lymphedema is. And I just wanted to have an opportunity to not only share about what lymphedema is, but also to share about the Live Today Foundation, because that's the premise of why I started the whole nonprofit to begin with. I saw
Right.
too many individuals, cancer
Mhm.
patients, and survivors all across this country and abroad who were living with lymphedema, who either did not know what they had, they were just told it was some swelling, or those that did know what it was, they weren't treating themselves properly for two reasons. One, they were embarrassed by the mainstay of treatment, which are compression garments, because they thought that their only choice was that nude color garment, of which there is nobody in the world that color nude. And I just wonder how that they ever even blended those colors to even come up with calling that nude. And then other individuals, for the most part, they weren't wearing their compression garments because they couldn't afford them, because Medicare, Medicaid, and private insurance would not cover
How about that?
compression garments from a disease that is caused directly either by your cancer or the cancer treatment. You're left with a permanent disease for the rest of your life with no backup from insurance to get you covered in the mainstay of treatment. So if you guys don't mind, I'd like to share my screen
Right.
so that I can share a couple of points with everyone. So this is about Live Today, and we are on a mission. We have a campaign entitled Lymphedema Can't Ruin My Survivorship. You know what? It almost got in the middle and ruined mine, because I, as a physician and a 15-year breast cancer survivor, about less than 2 years after my treatment from breast cancer, I was diagnosed with lymphedema. And my swelling was so severe that it disabled me from the clinical practice of being a physician. I've wanted to be a physician ever since I was 2 years old. So can you imagine, after practicing for 16 years and now being told you are disabled from the career you've wanted all of your life? Not only was that heart-wrenching, but it was scary, because I'm trying to figure out, okay, you know what? I got 2 kids. And I don't know about, your audience that may be watching this, but my kids had this insane expectation that they should be able to eat every day. And so now I had to completely reinvent myself to figure out how they were going to eat. And there are so many other occupations out there. You may be an esthetician, you may be a massage therapist, you may be a physical therapist, an occupational therapist, you may be a painter, you may be anything that involves the use of your upper or lower extremities. And now lymphedema leaves you disabled from performing the functions of your job, the essential functions of your job. And so that's why we are on a mission to spread the word and get the word out there, and to give individuals some tools that they can actively, readily use right now, to stand up and fight against lymphedema and say, lymphedema is not going to ruin my survivorship. Now, for those individuals that may not be familiar with the Live Today Foundation, I want you guys to know you can go out to our website at www.live-today.org. We have tons of information out there. I mean, tons. And it's not just about breast cancer or cancer in general, or about even lymphedema. My organization is entitled the Live Today Foundation. So we also focus on how can you live today and every day. So there are videos out there about yoga and nutrition and dietary supplements and all kinds of helpful information. And there's going to be some new stuff coming out. So you're going to want to make sure you bookmark the Live Today website, because we're going to be placing some more resources out there that's going to expand the horizon of how you live today and every day. Feel free to shoot us an email at info@live-today.org, or give us a call at 754-220-0234. And another point that I want to point out on the website, we provide free compression garments to cancer patients and survivors who are under-resourced, underserved, uninsured, underinsured, that are in need of compression garments in order to treat their lymphedema. And so out on our website, there is a bright pink tab entitled Request for Free Garment Application. It is a simple application that you can complete directly online. We get notified as soon as you complete the application. We then send you a miniature form where you can put in your measurements and select your own garments, select your colors, select your any patterns that you may want, depending upon which of our partners you choose to go with. And then your garments are sent directly to you. We cut out the middleman. For those of you that may follow us on social media, I want to remind you, go out to Facebook and Instagram at livetoday.org. That's livetoday.org. Follow us, and you can find episodes. I promise you, I'm going to make sure that, I can get a copy of this episode, because I want this to be out there on our YouTube channel too, because individuals may miss it, and we don't want you to miss out on any valuable information. But
we'll
today,
put all this in the comments too, for everyone to pick up.
yes, absolutely. Thank you, Ricky. I so appreciate that. So make sure you subscribe to our channel so you can find out all of the latest and greatest videos that we're putting out there, which includes also additional resources on how to live today that may be apart and separate from cancer, lymphedema, and the like. It may just be videos out there that will really help you to live today and every day. Now, I want to share this important video with you so that you can understand, just get a better understanding of the severity and the numbers of individuals we're talking about when we're talking about lymphedema. So take a look, take a listen to this.
Did you know that more than 10 million people suffer with lymphedema? That's more than muscular dystrophy, ALS, multiple sclerosis, Parkinson's disease, and AIDS combined. I'm Dr. Cherie, and I am the founder of the Live Today Foundation, a 501c3 nonprofit organization meeting the needs of cancer survivors living with lymphedema. As a physician, a breast cancer survivor, and a person living with the complication of lymphedema myself, I created this foundation with three primary goals in mind. One, to educate health professionals about how to even diagnose lymphedema, and to make them aware of the psychosocial impact of lymphedema on a survivor's life. Two, to educate patients about the importance of treatment and to make them aware of all of their treatment options. And three, to provide free compression garments to cancer survivors who are underserved and under-resourced in need of compression garments. Join the Live Today movement at live-today.org. Donate today, because every dollar counts towards providing compression garments to those in need. Thank you.
So listen, I also want to let you know, you heard those numbers. You've heard of all of those conditions. I know that everybody that listened to that video heard of all of the conditions that I named. And all of those conditions have had astounding amount of research that have been done. And they have access to a number of resources to help patients living with those conditions. Unfortunately, lymphedema in the most recent years is just now getting the buzz that it deserved decades ago. But now that it's getting the buzz, we're still behind the 8 ball, because until the Lymphedema Treatment Act was just recently passed, and until it actually goes into effect, there are still Medicare, Medicaid, and private insurance that is not covering the mainstay of treatment, which are compression garments. And there is still so much work and so much research out there that needs to be done about lymphedema. But some very significant research has been done about lymphedema that can really bless individuals who have been diagnosed with cancer and or those cancer survivors who have yet to be diagnosed with lymphedema. So people may be asking, well, what is lymphedema and how does it develop? Well, lymphedema can develop when anytime there is damage to the lymphatic system, to the lymphatic drainage system, or disruption in that lymphatic drainage. The lymphatic system has drainage portals, if you will, just like our veins and our arteries, right? And so anytime the system gets damaged and that lymph fluid cannot flow through its normal drainage system, if you will, the lymph fluid now drains into your soft tissues. And that's what causes the swelling. And this can happen anywhere in the body, but it is most common in the arms and the legs. It hits the extremities the most. And what's so important for cancer patients and survivors is that the cancer itself, cancer surgeries, radiation treatments, and other medical conditions, including chemotherapy as treatment, raises the risk for lymphedema. And so for a patient like me who was diagnosed with breast cancer, was determined to have 3 out of 16 lymph nodes that were cancerous. So the cancer had already invaded my lymphatic system. I had 33 treatments of radiation, and I had 15 rounds of chemotherapy. I got every insult that you could possibly name coming at me. And there was no wonder, no surprise at all that I developed lymphedema. But unfortunately, it wasn't until I saw my radiation oncologist that the word lymphedema or its risk even came into the discussion. And at the time, I was told that the risk was only about 1 to 2%. And so when it happened to me, I, being the person who I am, I just chalked it up to, oh, well, she said 1 to 2%. I should have known that I was going to be in the 1 to 2%. But as it turns out, the percentage is so much higher than that. And one of the reasons why we're talking about it today is that lymphedema is most common in women who have been treated for breast cancer. And so, I don't know why my fingers, here we go. So now,
lymphedema can't.
I want you to take a listen to this, because now I'm about to blow your mind with some information that physicians who are listening, this should be a game changer for you now, especially those of you that are treating cancer patients. This should be a game changer. Primary care physicians, you may be the first person to fill a mass or send a patient to, for their diagnostic mammogram or diagnostic ultrasound or what have you. This should be a game changer for you. And this should change how you converse with your patients who have been newly diagnosed. And you as patients, this should change how you speak and request and demand better monitoring for lymphedema if you are a cancer patient. Take a listen to this.
on my survivorship if I detect it early.
Lymphedema can't stop me from caring for my family if I detect it early.
Lymphedema can't take away my freedom of movement if I detect it early.
You can take control of your survivorship with simple early lymphedema detection before it becomes chronic. Hi, I'm Dr. Cherie Prentice, physician, breast cancer survivor, and lymphedema patient. Secondary lymphedema of the arms and legs is a risk after treatment for certain cancers, such as breast cancer, melanoma, and pelvic area cancers. A simple 30-second test can make a difference. SOZO is used to measure your LDEX score and can help your healthcare team identify early lymphedema and treat it before it becomes a lifelong condition. Learn more, find a provider, and talk to your doctor about getting tested by visiting impedimed.com. Get tested. Lymphedema can't sidetrack my life if I detect it early. Take control of your survivorship and get tested.
Okay, so Dr. Mo,
Wow.
Ricky, you all ready to hear about some astounding statistics? Listen to this.
Yeah. Go
Ladies-
back for 1 second,
Yes.
Dr. So I think you said a couple of things that, first of all, that lymphedema is a lifelong disease. So once you get it, you cannot get rid of it.
Mm-mm.
So what we're saying here is you have to early detect it, right?
You have to.
And if you can early detect it, you can not have it happen. Is that what you're saying?
That's exactly what I'm saying.
Okay.
That's
All right.
exactly what I'm saying.
Tracking with you.
So, and in order to detect it early, you got to know about it, right? Somebody has to talk to you about it. So
No one talked to me about it. No one talked to me about it. And I had 10 lymph nodes removed and cancer in 7 of them.
see,
And no one ever mentioned it.
It's really unconscionable, and it's now become part of the checklist of things that we are required to talk to patients about. You know, we, as the technologies become more advanced to help manage lymphedema, even things like surgeries, and we map the lymph nodes a bit differently now in some places. And there's a lot of new stuff coming down the pike. But the fact that, you know, people weren't told and that they're referred as an afterthought is really unfortunate. I know in my program, I refer every patient to lymphedema prevention before their surgeries, even if you're only having 1 or 2 lymph nodes removed, even if the cut's only half the size of my pinky finger, which the cuts are now. Years ago, the cuts were this big. Now they're this big. You know, and the more you tamper with that system, the more you mess with the plumbing, the higher the likelihood is you get back up in the pipes. But it is an area that so many women are living in fear about, and that they don't have enough information. So I'm really loving these resources, you know. And there was a really good study that came out of ASCO in 2021 that looked at, of course, who gets lymphedema the worst, who gets it the most, who gets it the worst, right?
Oh, well.
And of course, you can guess who it is, right?
Yeah,
Black
well,
women have
yeah.
an almost 4-fold increased risk for getting lymphedema because
Right.
Black race, they're more likely to undergo neoadjuvant chemotherapy or have cancer that's spread to lymph nodes that requires them to get chemo up front. They're more likely to get radiation to their lymph. They're more likely to have more lymph nodes removed because the cancers are presenting at an advanced stage, right? And you put in body mass index, and you put in weight and obesity and a bunch of other things, and there's all these risk factors for why women of color, why Black women are getting lymphedema at a higher rate compared to their white counterparts as well. So this is enlightening, Dr. Cherie. Keep talking, keep teaching.
Yeah, keep talking, keep teaching, girl.
absolutely. Thank you so much for pointing out that. I'm telling you, if we had more physicians, and when I say more, I mean, I need like 99.9% physicians like Dr. Mo. Oh my word. The Black Breast Cancer Alliance would have way less work to do. Way less work. But here are the numbers. 1.8 million newly diagnosed cancer patients every single year. 1.8. 50% of cancer patients are at risk of lymphedema. Remember, I said that it's more common in the arms and the legs. And 1 in 3 at-risk cancer patients will develop lymphedema. Now, those 3 primary areas where we see lymphedema at increased risk, that's the breast cancer, the melanoma, and the pelvic area cancers. 75% of lymphedema is diagnosed within 3 years of treatment, right? So that means these first 3 years are pivotal, they are crucial. And your risk increase with lymph node surgery, nodal radiation, and your taxane-based chemotherapy. But let me also point out that having cancer in and of itself, especially if it has already spread into the lymphatic system, is an additional risk factor, increasing your risk for lymphedema. Now, here's the beauty, is that early detection and intervention are key to preventing lymphedema, because 95% of patients in the large clinical study done showed that 95% of patients did not progress to chronic lymphedema when there was early detection using LDEX and intervention. Now, remember in that video you saw that beautiful Black woman step on this, it looked like a scale. You saw both her feet and then her hands. It's just like a little scale. In 30 seconds, it measures what's called your LDEX score. Just imagine, you know, for us people out there, let's say we're going to take out the doctor speak. It's just measuring your intracellular fluid level in your body. So it's just kind of measuring what that fluid is looking like, right? And so, like Dr. Mo said, when you're in a lymphedema prevention program where you are measured prior to any surgery, any form of treatment, it provides the best baseline possible. However, if for some reason you have had surgery, you've had some treatment, but you have not been diagnosed with lymphedema as of yet, you haven't detected any early swelling, it is still, if you're hearing this and you say, oh my God, well, I've had surgery and I've already had 2 rounds of chemo, do I still need to be monitored? Absolutely. If there is a monitoring program at your institution, get into it, because there is still time, there may still be time before we see the clinical evidence that lymphedema has set in, to be able to intervene when this new technology detects what we call the trigger. So you get that baseline score, right? You're measured every 3 months. That's those first couple of years, that year 3, you're measured every 6 months. When there is a difference that marks what we call the trigger, not those small little changes, but there is a scientific formula, if you will, that when you reach a certain point, and it's called a standard deviation, when you reach a certain point, the clinician knows this, and the technology is able to pick it up. When you reach a score that shows that your swelling has gone past a certain point, even without you seeing it, you may not even feel any tightness, you may not even feel any pain, you may not feel any symptoms at all. But the technology has picked up on it. That serves as a trigger. And with intervention, where we can put you in compression garments 12 hours a day for 4 weeks. If you can imagine reshifting your lymphatic system, if you will, to kind of divert that extra lymphatic drainage that was now sitting in your soft tissues. We can kind of like trick the system, if you will, to redirect that lymph flow into open areas where that lymphatic, where the lymph can actually drain into. We can equilibrate the system, if you will, the lymphatic system, and actually prevent chronic debilitating lymphedema from occurring. And this testing is so easy. Stepping on a scale, your clinician monitors your score. It is kept as part of your medical records. All you have to do is just show up for your regular monitoring. Anytime there's a trigger, we put you in compression garments. Wear the compression garments. You continue to be monitored. You don't have to live with the chronic debilitating lymphedema like I have had to live through. You don't have to change your career your profession, your clothes. You don't have to add on this extra financial burden of buying compression garments every single year. There's a daytime garment and then there's a nighttime garment, and they each come with their own expense. And you need to have at least 2 sets of each every single year, because while you're washing one, while it's drying, air drying, you need to be in another set of garments. You can't wait all day and not be in your garments. So you need that extra set to get into. Plus, after about 6 months, it begins to lose its elasticity. And so the compression garments are not really providing you with the proper compression. And so now you need to replace them. Average set of
Gotta
garments.
trade them back in.
Huh?
You should be able to trade them back in.
You should be, but you can't,
How
unfortunately.
about that? Wouldn't that be something? A
Wouldn't that
sleeve
be
exchange
nice?
program. You know,
Wouldn't it
Dr. Cherie, that might be an interesting proposition for these companies, a sleeve exchange program, and helping those people who are under-resourced be able to get access as well.
Oh my goodness.
Wow,
You
let's check
brought
it out.
up something, Ricky.
That's it.
Yeah. All right, well, go back. So here I am. I just got diagnosed with breast cancer.
Hmm.
My head is spinning. And now everything that's coming at me is like, want. And I don't know what to do. And we try to provide resources for what questions to ask your doctor. And we have to add this to our list, Mo. I'm gonna
Well,
work on
yes, and you know, depending on at what point you're getting your surgery, lymphedema is typically discussed before your surgery, but um, it's not really shared as much before chemotherapy, right? It's not talked about in the context of radiation typically, unless you have positive lymph nodes and you're going to get radiation to your lymph nodes, and it can be completely overwhelming. I know that in our packet, you know, new cancer diagnosis, you know, folder, yep, there's some pamphlets on lymphedema, but how many people actually read those pamphlets?
it. Nobody's reading that. Nobody's reading that.
Exactly. Your mind is already swimming with things. And so it's up to the clinician, up to the doctors and the nurses. And, you know, like I said, it's now a quality measure in cancer programs it's a marker of quality to make sure that your patients are referred for measurements. The tricky part, Dr. Cherie, is that looking at how we do measurements and whether or not people are doing what's called bioimpedance, right? That measurement that the LDEX does, because most places you go, they're measuring the wrist, the forearms, the upper arms, and they're just taking the numbers down, but getting to the actual data about the resistance of the fluid through your tissues, that type of stuff, there's good studies that are starting to come out about that now. And these are clinical trials, Ricky, that people should, you know, participate in, that aren't drug trials even. You know, there was a study called the PREVENT trial. It was a clinical trial, and they looked at women who had lymphedema, who are at risk for lymphedema. They looked at how we measure. Are the tape measurements versus bioimpedance, and they found that when you measure it more specifically, more discreetly with bioimpedance, you're able to intervene sooner. And that was a whole clinical trial that was done.
Yes. And that's what those numbers that I shared came from. That clinical trial, I mean, that it was large. If that clinical trial, I just stop and think, if that clinical trial had been done 2009 or 2007, prior to my diagnosis, I just stop and I think how very different my life would be right now. And because of my faith and my walk, I don't dwell on, you know, why or what coulda, shoulda, woulda. I use this as my testimony, and I take what felt to be very something that was very miserable, and allow God to turn it into a mission and part of my ministry. So I'm learning to walk in where I'm at, but man, sometimes you can't help but think, what path could I have been on that may have been different? And I know that I now have the opportunity to save so many other women and men out there from this, what I call a diabolical disease, because so many times over my course of I'll be a 15-year survivor in October.
Bless you.
Thank you. I think about the number of times I've come across individuals, and I'll say, you know, when I made it to the 7-year or the 6-year, and people are like, oh yeah, you made it past 5 years, you're cured. Woo! You know, they say that. Okay. I and Dr. Mo and Ricky, we know the tenuousness of that statement, and no, you don't. Yeah, no.
Yeah.
But you can get to a place where maybe, let's say, you were doing close monitoring for a while with your breast cancer. I know me, I was going in every 6 months. I wasn't on an annual mammogram. I was, every 6 months. For
I refuse to stop going. My doctor said, you're done. I'm like, no.
No, girl, I'm coming.
I'm coming.
My patients do the same thing. You give them the option, they're like, nope, I'm good with this is working.
Good, I'll be there
stay with it. That's right.
Exactly.
Yeah, I'll be
Exactly. But as I was able to transition from the every 6 months to every year, and at least feel like I was moving to the path where, okay, I'm now like, every other woman, I'm going to get my annual mammogram, right? And not every 6 months. Unlike with lymphedema, I now have to live with this every day. Every single day when I don my garments, I am reminded of my cancer journey. And I am reminded that this is a disease. People want to call it complications type of, it is a disease. Lymphedema is a disease. It is a
lifelong disease that you can't. Wow.
One disease and treatment of it caused another that you will live with for the rest of your life. I don't care how many people call me cured from breast cancer. You will never be able to call me cured from lymphedema outside of God rotting a mirror.
Outside. Well, this is like a message that we have to get out to women, and it has to be part of the initial conversation with the doctor. So really, how much time do you have to be able to do this scan and do what you got to do to prevent it? Like, how much time do you have?
You mean how much time do you need to do the scan?
Yeah, or not the scan.
The scan is
quick, but I mean, at what point, like, what if you are getting, when do you do it? Before surgery? Before, like Mo said, she talks about it before surgery. Like, at what point do you sort of interject this conversation with your doctor?
So, Dr. Shree, I guess I can answer that too, and you can also. And the answer is at any point, every point, especially before surgery, after chemotherapy, before radiation. Like, there's always room to have this conversation, because sometimes patients don't always make it to get measured before surgery, right? You got a lot going on, and it's a lot of visits, and it's another appointment to come back in, it's another copay, etc. And so that can sometimes be a little bit limiting for people, but it should be on the checklist of things. When we talk about our surgery, we go over the risks, the indications, the risks, the benefits, and the alternatives. And when I talk about the risks of surgery with my patient, at that point I say the risk of surgery is risk of bleeding, there's a risk of infection, there's a risk of reoperation. We talk about why you might need more surgery. There's a risk of lymphedema or swelling in the arm. You mess with the plumbing, you get back up in the pipes. That's the easiest way I can explain it to them. And then we talk about what those numbers are and what do we do for that? And you just gotta, and there are stages of lymphedema. So once a person has it, then there's a whole sort of staging to get to really, really bad. Because you've seen individuals who have terrible lymphedema, and then you see individuals who maybe have some, and their rings are tight, and they're managing it the best way that they can. But that conversation, as far as your question, Ricky, it needs to happen at every point, but it needs to be documented. And for quality measures, it has to be documented that we discussed lymphedema prevention with patients. But the quality of that conversation is really what Dr. Shree is getting to, and we need to elevate that conversation and not just check that box, because that's what happens.
Yeah, well, especially if you're getting, if you're doing chemo first, right? So, I mean, so I'm going back to my patient head, right? You're doing chemo, you've been whatever, you've got 6 rounds of TAC or whatever, Keytruda or whatever, and your brain is foggy, man. You're weary, your body's weary, your brain is foggy, and you got more stuff to do coming at some point soon. Like, you're not thinking with all pistons working, man, to figure out, oh yes, it's got to go on my list. So we got to figure out what kind of tool we can give people to make this the top of mind conversation. And maybe you have the conversation up front with your doctor before anything, just so when it's on the whole list of it. I mean, I don't know, you're overwhelmed then too, but it's, it can't get left out.
It can't. And as on your cancer journey, on this cancer continuum, You are always overwhelmed.
Right,
You
we're always
are.
overwhelmed.
But see, here's our
Super
chance as a physician, like what Mo can do when she's listing out the various different, complications of what could happen. Now physicians have the opportunity to say, hey, you know what, there is a risk of lymphedema. And I love the way she put it. You mess with the, how did you say? Mess with the,
You mess with the plumbing, you get back up in the pipes.
get back up in the pipes. Then she now can say, but you know what?
And people understand that. Yep.
We can monitor that. We can monitor that, right? And so there was a time when we couldn't, but there is better technology out there. I know this is a lot to process, but we can monitor you for this so that when we get you through this cancer journey, when we get you through your cancer treatments, you're not left with another disease process that you got to work with. So I know it's a lot, but let me get you scheduled.
That's where strong navigation comes into, Ricky, and that's the role of the
navigator. Yeah,
because when I have that conversation, even if they didn't hear it, and I say now there's going to be another appointment where you're going to meet with our lymphedema prevention therapists, our physical therapists who are trained and specialize in lymphedema. They're going to talk with you some more about these things. And at that appointment, there's a lot of fear that happens. There's a lot of, things. Don't do this. Don't garden. Don't get your nails cut. Don't don't fly. Don't, and there's a little bit of a friction between the surgical world and the therapists, even because the data shows, yeah, you can get a blood drawn if you need to, right? You can get a blood pressure done if you need to. But that conversation with the patients, the navigator has to help that patient now get to that therapist to have that conversation. And when there aren't navigators who's full-time, who are dedicated to making sure that those patients see those appointments through, that's where people can fall through the cracks. So the navigation, I think, is really key.
It is.
And that's where, what my position on this is. We got to teach patients what to ask for, just in case the doctor doesn't do the right thing. You know what I mean? And we just got to, add this to our checklist and teach people what to ask for and say, this is something no one's told you yet, but you could get lymphedema. Hello. It's a lifelong disease. I mean, I think that's part of the initial conversation when you get diagnosed. And I mean, there's a lot going on, but.
Correct. And here's the beauty part. Here's the beautiful part about it. I'm going to share my screen again because we actually we can help patients. So here is our website. All right. And so here, generally start here. But if you go to lymphedema prevention tab, and you come on down, there's a video I shared. So here under educate your cancer care team, here are the same statistics that I originally shared. You can print that out for them because you know what we're finding is every institution is not as well informed as others. And so sometimes and not just the institution, but individuals that are part of your treatment plan may not be as well educated on this. So here you can provide them with some added information. But right here, Ricky, to your point, questions to ask your doctor. Look here. So now you're not sure how to start a conversation with your doctor, your nurse, your therapist about lymphedema. Okay, so you can start off by asking these 3 very simple questions during your next visit. Do you have a lymphedema management program? If you do not offer a lymphedema management program, where can I get lymphedema care? Number 2, what tools do you use for early detection of lymphedema? Because remember, as Dr. Mo pointed out, there are some that are still using tape measure. Okay, there's some subjective bias in that, and time to time using a tape measure, if it's not done by the same person in the same area, there are some discrepancies that can occur in the measuring. That's why this technology is so critical and crucial, because it takes out that individual bias of the person that's actually performing or doing the tape measures. So do you offer LDEX testing on a SOZO device? And then lastly, you can ask, how long do you monitor patients for lymphedema after cancer treatment? Because remember that statistic, 75% of cases show up within those 3 years of treatment. So knowing that lymphedema develops up to 3 years or more after cancer treatment, how can I be monitored long term? This is a PDF that you can print out. You don't have to remember these questions. Print them out, take them with you. You don't want to read them, hand them to your doctor. Hand them
Right.
to whoever you see.
But we
Say,
just have to get people to know that this even exists.
That
You
it
know
exists.
what I mean, that this even exists. How do we make people know that this is something they need to be thinking about? It's got to be on that sort of checklist of even before you get to this list. You know what I mean? Like,
Exactly.
at what point do we insert this in the conversation? And when you're already overwhelmed with stuff. I mean, you know, I have Graves' disease as a result of all the chemo I took. No one told me that I was going to get a complication, a lifelong disease, as a result of cancer treatment. You know what I mean? So we're just trying to get through the treatment. We're just trying to get the cancer out of our body. We're just trying to deal with the C word. And then you got to say, oh no, you know, your treatment could give you this too. So we've got to, you know, talk about this more and really just equip our breasties to know what's even asked for.
Absolutely.
Yeah, and for people who have been battling this, it's a good time to revisit the conversations with your doctor about, well, what are the therapeutic options? Because there are new and emerging surgeries that we do where we can take lymph nodes from other places and put it into the armpit now, called a lymph node transfer. We can take omentum from your belly and put it into those areas, and you can reconnect these lymphatics. You can do bypasses, and we reverse map now. So we map to see, we give the dye here instead of in the breast. You know, when you had your surgery, they probably gave you dye in your breast to try to find, well, if the train left the station, where's the next station, right? And then that's what we take out.
I had, right, the sentinel.
Exactly, with the lymphosure and the blue dye and all the things. But now we can map the arm and see, well, where does the arm drain to? And we can reverse map even to see, so we won't take that lymph node unless we absolutely have to, which ones are draining the arm. And so we're getting more sophisticated in our approach to lymph node surgery even. And it's a good thing because there's a lot of people who have been battling lymphedema really, really bad, not just in their arms and their legs, but even in the breast. And we don't even don't get me started on lymphedema in the breast, right? Because what happens after we cut your armpit, that drainage. We cut it and then it backs up into the breast itself. And there's no sleeve, right? There's no sleeve for the boob.
No, ma'am. No, ma'am.
So we got a long way to go, but this is a huge step.
God.
Yeah.
And the last thing that I wanted to point out, I want one of you to throw out a zip code in the, you know, Dr. Mo, if you could throw out a zip code in the Chicagoland area.
Oh, I don't know. I would say pick DC area, but I don't know anybody in the Chicagoland. I don't know what the zip code is. I don't know.
What? Okay, let's pick DC. Let's see if I can find an LDEX.
Here, I got, well, I'm in Annapolis. Can I do mine?
You sure can.
21403.
See if we can find. Woo, here you go.
Look at that.
So we got Johns Hopkins,
Lots of them.
Forever Fit. We got lots of them. These are all locations that have a SOZO device, that bioimpedance device that can measure and detect lymphedema early. And I can't tell you the number of times that I have presented on lymphedema, and I've thrown this up, and I'll just have a random person in the audience, hey, throw out a zip code, and I can go through 3 or 4 different zip codes, and I see patients and caregivers go, and they're looking around because they're like, that's why I was treated. And no one ever said anything to me about monitoring. No one ever mentioned to me about a lymphedema prevention program. And one person, I had one patient to say to me,
Wow.
she said, I was there. I just had my surgery a month ago. Now, I do recall the doctor said to me, we offer a lymphedema prevention program. Do you want to be a part? And she said, the way they phrased it, she says, it felt like an option. And right then I was like, well, you know, maybe not now, maybe later. And she goes, so do I still have time? And fortunately for her, it was in the first month. She was able to get in. She had a great baseline. And she's doing good, and she's in the monitoring program now. But you know how many patients? That was nothing but being in the right place at the right time. There are too many patients that we miss as a result. If we as physicians present it as, as an option, there's a way to present it that doesn't evoke additional fear. Again, Ricky, like you, we've both been there. We know what this feels like to be a cancer patient. But if you present it as, do you want a Kleenex or not? And if you just want to keep sniffing,
Right.
benign, then that's how you're going to, as a patient, say, well, if the doctor kind of presented it as, well, that's low, and yeah, I can. There's a way of finesse. So I'm working with physicians as well as on the patient side to try to figure out that finesse and being able to have this conversation with patients in a way that we know that they are already in a heightened state of alarm, but there still is a way that we as physicians and how we relay this information to patient navigators who may be holding the patient's hand along this cancer care continuum, that can position it in a way and at a time that still is best for the patient to get in for the proper monitoring, and then at a time where he or she can receive it, understand it, appreciate it, and act appropriately on it. So
All
I
right.
thank you guys for
So
allowing
we
me.
need that video
Incredible.
on our website. And actually, Dr. Sheree, we need for you to make a video for our website and for our YouTube channel, so we can put it up.
Yes, ma'am.
You know what I mean? And let's
Mhm.
let's put it up there as part of our thing. And Mo, we have our doctor question thing on the more than just .us site, more than just word.us, if you want to have questions
Yep.
to ask the doctor. So we're going to actually link that back to our website too, because, and we need to talk about this, because this is something that needs to be brought up, right when you're talking about your diagnosis and your treatment plan.
There's so many things that, get glossed over under the umbrella of cancer, and it's hard to know how to time it and when to go back and revisit these conversations. And I think that that's another important thing for physicians, is to know that just because you say something once doesn't mean that that's the only time you should ever mention it. Because what happens is you say it and then the person leaves, and then if I
Right.
say it right before your chemo and then you go 6 months of chemo and come back, well, yeah, I said it 6 months ago, but did you really hear it?
Right.
Did you remember it?
Right, and you're
And
foggy. At the end of chemo, you're so foggy, you're not gonna remember it.
exactly,
You're not gonna remember it.
exactly.
I think
And
the most
so it's
important thing is to have it have touch points along that whole
exactly.
right. Breast cancer,
Mhm.
okay, mention it. Okay. Patient navigator mentioned. Okay. Okay. Med onc, radiation onc.
Yep. Same thing with clinical trials. Same thing. We have to normalize these conversations, right? And the fact that it's not optional. This is
Right.
part of our pathway. Our
Right.
therapy for you includes these things.
All these things,
Right.
I talked to a brand new patient today, and the first thing I ask everybody that calls me is, what kind of breast cancer do you have? And I would say 80% of the time, they don't even know what kind of cancer they have. And I actually looked at her biopsy report, and the biopsy report said, you have a malignancy. It didn't even say ductal carcinoma, like invasive ductal carcinoma. It didn't say anything. And so she's in some little town 200 miles from Dallas, between Dallas, I don't know, somewhere in Podunk, Texas, right? So they're just not getting the care. People aren't getting the care that they should be getting, where they even think about all these things. I think we have to pull out our list, Mo, and let's brush up our list.
Let's
and
do it. Absolutely.
Put it on the website, and maybe write another article about it for Black Doctor, because I just feel like there's so many things that have to be our responsibility as the patient,
Mhm.
Yeah.
and I mean, I wish we had everybody was like Dr. Mo. I wish you could can't you just take them all to school again, Dr. Mo? And I know you're teaching everywhere. Can't you just?
I'm working on it. But no, it's just
I got an idea for you. I gotta solve for that.
I love it. I love it. We got to do it. But I think that what we're doing on the part of the cancer programs, on the structural side of things, is really trying to make sure that we document when we have these conversations with patients, and that we follow through on what those decisions are and how those interactions go, and that it's becoming much more standard of care than it ever was. And so a lot of work is being done on the back end by the bodies that govern cancer programs and breast programs, the societies that accredit us to say we're certified, centers of excellence, that sort of thing. There's a lot of work that's being done to really make sure that we're offering clinical trials, offering plastic surgery referrals, offering lymphedema prevention, offering diet and nutrition and psychosocial counseling, all these things that people didn't get years and years ago. And now we got to make sure that everybody has access to them and that we're not just checking the boxes. So our work continues, Dr. Cherie.
Yes, it does. Yes, it does. And we're the right people to do it.
You
I
better
know we
believe it.
are. We're here. This is,
Yep.
Not us, then who, right?
That's right.
So
Wow.
send us your PowerPoint, send us your videos. We'll post everything, and we'll, share your social media, and we'll just, get this word out.
Mm-hmm.
And that's the best we can do, and just try to, educate our breasties about.
And let's follow up with a live too, maybe Dr. Cherie on Instagram or something, and to take
Instagram
questions, and you
Yes.
know what I mean? Like, let's
love
get real time questions and invite people to come on who've had lymphedema. Like, there's some fun things on Instagram settings where we can really invite people in real time to ask their questions and pop up, and we should do that.
I would love it.
Let's get some breasties who actually have lymphedema
Mm-hmm, mm-hmm,
and show what it looks like. And we'd even talk about the sleeve program that you guys are providing sleeves, and the sleeves are some.
Yeah, let's close with that.
Cool. Yeah, pretty cool.
Where do people go?
Okay,
Yeah.
so they go out to the website, and actually, why don't I do this? Let's do this. Let me share my screen again. If they go out to the website, I'm gonna show you guys. It's real simple and real easy. If we, I'm saying it's real easy, and I can't seem to get to my. Oh, you know why? Because it took me.
Yeah, and your accept cookies thing is
There we go. All right.
you go.
So can you see? All right. So now, right here on our website, www.live-today.org, you click right here, request for free garment application. When you click right there, apply now, it takes you through some simple questions. Boom, boom, boom. You set what you need. When you apply and it is completed, we get immediately informed via email. And then as soon as we see that an application has come through, our current 3 partners are Medi, Juzo, and Lymphedivas. Now, Lymphedivas offers you an option of solid colors as well as prints. Medi and Juzo are the solid colors. But there's a difference between circular and flat knit, blah, 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 blah. They're all compression garments, okay? And so we have an opportunity to get you into the compression garments of your choice. And once we have your application, we send you a form, Juzo, Medi, or Lymphedivas. You're able to make your selection after you have your measurements. And we tell every patient, please, please, please make sure you are measured by a physical therapist. Even though we have the sizing guides that get sent to you, we really advocate for individuals not letting someone else do this measuring, because we cannot accept returns. We're just not in the place and space to accept returns, get them back to the vent. We're not doing that. And so it's a one-time request, and we don't want to waste dollars on either side. So by the time you need compression garments, you should have been seeing physical therapists. Right. So you let that physical therapist do the measuring. And then once you have your measurements, you go to that website, Medi, Juzo, or Lymphedivas. You pick out what you want. When you click on the link that we give you, that information comes directly to us. And someone from my staff fills your order with Juzo, Medi, or Lymphedivas, and those garments are mailed directly to you.
That's awesome. We're going to try to help people don't need those, because we're going to try to do the prevention side of it. But
exactly,
for people who have it now, for people who have lymphedema now, are living with it, this is a resource for you.
Right. My goal is to move towards, you remember when I talked about that trigger and how if you have intervention where we put you in compression garments for those 4 weeks, my goal is that Live Today would be providing those interim compression garments, not garments needed for lifelong. If Live Today, down the line is that organization that provides those free compression garments for that interval treatment that will prevent you from getting chronic debilitating lymphedema. Oh man, the smile that I would have on my face walking around, I would have smile lines continuously. That would be an absolute blessing and a dream for our organization.
We're going to help
That's
you do
incredible.
that. We're going to
That's
help you do that.
incredible.
There we go. Thank you.
Well, thank you, Dr. Cherie. It's always
Yes.
a pleasure to have you, and you always come armed with information. And this is, you're saving people from a disease they don't need to get.
And
Breast
able to
bad
do
enough.
because you created a platform for me to share. So thank you.
And it's Lymphedema Prevention Awareness Month, right? All month. So you can find Dr. Cherie, you can find content, you can find facts, you can find information. Where, Dr. Cherie?
At www.live-today.org.
There it is. And on social media platforms?
At livetoday.org. That's Live Today, DOTORG. And on YouTube, just Google, not just Google, just search the Live Today Foundation and subscribe to our YouTube channel.
Awesome.
And you can
Wow.
always find her from me, Ricky at touchbvk.org. I
That's
know how to
it.
find her.
You better believe it. I'll be broadcasting and sharing your information and your posts on my social media as well at Dr. Monique Gary. So we're going to do it.
Thank
We gotta
you.
do it.
Well, let's do an Instagram live. Let's plan that soon. We'll call you. We'll plan.
Absolutely. I love you.
Fantastic. We love
All
you back, and we hope it's been relatable and reliable and real. That's what we do every
Absolutely.
Wednesday night here on Black Doctor, and we are so thankful for the platform, for the sponsors, for the breasties, for the lived experience, for the hope, Dr. Cherie, that you're providing to everybody, and Ricky, for you, for your visionary leadership in even developing this platform for all of us. So we are just great.
Together. All
That's
right.
it.
Breasty
Breasty
love.
love.
Resty love.
Breasty love. Breasty love. You guys, this is fun.